Thank you for staying with us. We continue here. The Health Department is warning of a shortage of human insulin pen devices for people with diabetes. Manufacturers are said to be only offering human insulin in vials, which will require people to inject insulin with syringes. Now, the department has directed health facilities across the country to ration the distribution. The SA Medical Association Chairperson, Dr. Mvuyisi Mzukwa, joins me now to chat more about this. Dr. Mzukwa, good to have you on the program once again. Can you elaborate on the specific consequences that shifting from insulin pens to vials and syringes will have on diabetes patients in the country?
Good afternoon to you and to your and thanks for having me. Understand, all chronic conditions, they require, self-care, but they also it must be sustained for a very long time. Now, there's what we call treatment burden, where you find that, people are struggling with finances. You would argue and say these are state patients, but they take transport to hospitals. But the other issue is that of a medication. For example, if you are, for convenience, a patient must be able to take medication with ease. There mustn't be any struggle. So with, the pen, it was easy to use it. It's less painful. It's very convenient, especially to the most vulnerable. Talking about children, we're talking about the elderly, and all those people that have visual challenges. So these are the issues that need to be considered. Whenever you are prescribing medication to a patient, you want to prescribe something that is convenient, something that is going to be easy to use. So these vials are not easy to use compared to the vials. So the other thing is, when there's a survey that has been done by the Doctors Without Borders, they found that 82% of people prefer to use pens than vials. So it tells you that people are more comfortable using pens than the vials. But the thing is, if people don't want to use medication because of inconvenience and all these other complications, it then leads to people not adhering to treatment, but also it leads to people developing complications of diabetes, and that might cost the state more. In fact, it costs the taxpayers more.
I want to expand on some of the issues that you touched on, especially on how this transition impacts different demographics. I'm thinking about the elderly here. You mentioned children and people who are visually impaired. Let's expand on this particular aspect. Who does this affect?
Yes, like I said, the most vulnerable. You can imagine, because if you are given treatment, you need to be trained on how to use a pen. So it means those people that are going to be given vials, they need to be retrained, onto how to use it, how to store it, and when do you change the needle and all these things. Now you're talking about a person who's already been trained, on the other instrument. So you need to now retrain them for the vials. But the thing is, you're dealing with people who have got challenges. I mean, diabetes on its own may complicate by having people having blindness, or they may have partial sight and all these things. On top of the fact that they are elderly, with children as well, there are challenges there because they might want to use it like they use the other, they use the pen, not realizing that now they are doing this. Because you must remember, with this vial now, you've got to draw in the insulin, you've got to make sure that you are taking the correct units, but also the needle might be a little bit painful than the other one that is used for pens. And so that moment, because we must remember, when we talk about a treatment burden, it leads to treatment fatigue. The time that people take, to inject themselves must be reduced. It must be made more convenient.
Can you provide insights into the cost differences between insulin pens and syringes and how this affects the healthcare system in the country?
Well, actually, you might find that the vials, it might cost the state, because you are separating the two now. You are separating the vials and you are separating the needles and the syringes. So it might actually come out to be very expensive for the state. But also, like I said, the training of this, it might lead to what do you call this? People wasting, not necessarily purposefully doing that, but because they are not trained, it might go to waste. So it's important that when we look at the costs, we also take into consideration the process itself, how these people are using it. Because if you look, if we want to avoid treatment fatigue, where patients say, "I'm tired of this thing and I'm stopping taking any medication." So we don't want people to get to that level. Hence, we must make sure that whatever we do, we challenge our Department of Health, also pharmaceutical companies, to say, if you want to save lives, just think about the process, what it will cost the nation to introduce these vials instead of using the convenient pens.
You mentioned pharmaceutical companies. I mean, what role do companies like Novo Nordisk then play in ensuring a continuous supply of insulin pens?
The thing is, we've got a serious challenges of these Western companies who, when they come to Africa and all these other lower-income countries, they tend to charge double the price compared to their European counterparts. We've seen that when it comes to COVID, they tend to prioritize Europe than Africa. So you would think that they would understand that, if Africa has got a problem, it affects the whole world. If you can't manage one aspect of a healthcare system in one part of the world, it actually affects the whole world. So when it comes to these companies, they tend to profit more when it comes to the low-income countries, which to me doesn't make sense. And as corporate global citizens, I think that's what they need to think deeply about.
And as we wrap up, can you share, call it personal experiences or stories from patients, for instance, that really highlight the importance of insulin pens in diabetes management?
Well, like I said, I've got lots of patients that I deal with by using pens, and some obviously will be using vials. The thing is, when it comes to patients using, vials, sometimes they don't know. Nobody has explained to them how it works, because at times you're dealing with institutions that are overpopulated. The patient population is high. So, even those healthcare workers who might want to explain, but you are taking time, attending other patients as well. So you find that you've got this patient who's got everything in front of her or him, but cannot use those things.
Right.
And the other problem is, even if they want to change, they don't have money to do so. They solely depend on the state. So they will really depend on what is supplied to them instead of what they prefer. So it's not only about treating the disease itself, but the psychology around it as well. You are affecting, the psychology itself. So it means that if we are serious about this, we'll have to think deeply and make sure that we reduce the treatment burden, so that we avoid this treatment fatigue and people complicating and even dying from these conditions.
Right. Thank you so much for your time, Dr. Mzukwa, and really shedding light on this critical issue. It's become quite clear that ensuring the continuous supply of insulin pens is quite essential for the well-being of diabetes patients in South Africa.